What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering mobile X-ray. And we're not talking about just, since I work at a trauma 3 ER, like at the emergency room. No, we're talking about true mobile. You're in your little van or whatever car they give you, and you're actually going to people's homes, to senior homes, to wherever these patients may be, to actually do imaging in those places. So, to give you context, I am a night shift X-ray tech, work a lot of day shift, and I've sat down with a few X-ray techs who've been in the field for a very long time, and I've acquired a lot of knowledge and information from this aspect of our field. So, you use different machines than you do like at the hospital or other places. You just have, they have, the best way my partner who did mobile X-ray is like you have a van and then you have like a lead. Some places you have lead, some places you don't. You have little cassette holders if you're lucky, and you have your X-ray machine and you're just driving. So you'll pull up to your little joint. They can give you a list of, let's say, 8 to 6 patients around your city or wherever, however far little jurisdiction you operate in, and it can vary all types of exams from chest, ribs, feet, or whatever's going on. And they have various different shifts. My coworker did like, I think, the afternoon graveyard shift, and there's like midday and then morning shift. She highly recommend doing night shift-ish because a lot of people refuse their exams because it's really, really late. So I don't know if that works for you. That can be done. But then again, day shift will leave stuff and it'll be the same thing regardless if you work here or you work at the hospital mobile. It's always the beef between days and nights. So she's told me there's been times where she's had to maneuver her little X-ray machines upstairs, and it'll be kind of like a teeter-totter situation, and it'll just to get it all the way up there, and the patient be like, I don't want it, or can you do it later, or whatever, and causes problems, and you're just there struggling just to go back, tell them, hey, the patient didn't want it, or hey, whatever situation, you couldn't get it done. Or even though you could struggle to get up there and it could be a simple 30-second exam, but just to get to the actual, from unloading it, reaching the patient and coming back, it could take you an hour just because of the obstacles or whatever's going on, and it can be tedious and redundant. And some places you're literally just trying to maneuver the patients to be away from other people, for ALARA purposes. And then you'll just find yourself telling the patient, hey, can you hold it? Hey, can you just like lean against the wall? Finding any kind of trick. Because she surprised me many times at the hospital using her mobile tech job skills to get images done. There's very different techniques that I wouldn't thought of. And to do it standing or to do it and not have to hold the board. So it comes with certain perks too. She told me like, she'll start her shift like about, I want to say 3 to like midnight in some cases. And you'll drive and like it'll be 30 minutes to an hour in between each patient. And you'll just be chilling. You'll just like be chilling. You don't have to like give reports on the images. Like you just take the actual X-rays. So, but she did tell me that all the X-ray machines, once again, shitty mobile image like equipment. If you're lucky, maybe you got a new one. If not, it's the same thing regardless of where you go, which I've been telling you, it's always shitty equipment. But I will say I've been told by many techs who've done mobile that your technique game has to be more on point, or you'll have to set more techniques during mobile X-ray compared to here like at the hospital. Or it's like, it has like, you can use like some of the basic settings and you don't have to adjust it more because like I said, mobile imaging, like the readout or the image quality isn't as good, so you have to be like fine-tuned, like KVP mass adjusted way more than we would have to at the hospital. Or maybe because our equipment can shoot hotter. I'm not quite sure. It just kind of varies on the places you work at and the equipment and stuff like that. I do know that they are on call overnight, depending on what shift you work. Your on call will vary, and they'll call you in the middle of the night to get something. But she's told me many of the times that even when they call them, some of the times by the time they get there, the patient's already left to the hospital because their chest pain's so bad. It's like, well, you could have just, if it's that bad, you can just go to the emergency room instead of like waiting for us to go from our house to go get the van or whatever and then drive all the way to where you live just to x-ray you, and then you have to wait for your report or whatever, how long that takes. So there was not that many times where when you were on call to go imaging people, she would actually have to do it. She's told me that most people who do mobile imaging usually are people who are very new to the profession or are at the end of the profession and just want like a pretty chill gig. I mean, I know she's from Florida, and she told me that the pay wasn't as good. That's why she came to our place. So I'm not sure here. She says here in the state of Texas, they pay a little bit more better for mobile. I think it was like 30 an hour. Can't remember exactly. She said over there when she started, they were paying her like 16, 17, which I'm like, this is pretty low. But she said it was a pretty chill gig, but it was just not that much money. So, me personally, if I'm gonna do x-rays, you at least 25 plus. I mean, especially in the shitty economy we're in, a minimum you gotta be just to even survive. Luckily on nights with shift diff and all the other bonuses, you get a little bit more money. So that's kind of all I got. I mean, I know that mobile, they work all the time, so it could be weekends, it could be during the week, it could be the holidays, it could be all types of, but then again, you have the elements to deal with that we really don't have to, especially in the emergency room at the hospital. You know, sleet, snow, whatever stuff's going on, you're out there with your little shitty equipment trying to get stuff done, so there's that aspect to it. So as always, it's been your boy Miguel. We'll see you on the next one.